Thank you to everyone for joining us today. For those of you who are joining us for the first time, iCourts is a community of practice whose goal is to connect people who work in the social and behavioral sciences field of neglected tropical diseases. Once a month, iCourts hosts a Knowledge Cafe webinar where we provide the opportunity for community members to present on a topic of their choice to a global and virtual audience. If you have any ideas for a Knowledge Cafe, please reach out to us at info.icords@gmail.com. And if you'd like to join as an iCourts member to stay up to date on our activities and events, click the link in the chat to fill out the Google form or scan the QR code on the bottom right of the screen. This webinar was developed in collaboration with the ANISVAD Foundation. Today we have two speakers, Dr. Gloria Dada-Cheche and Dr. Emilian Epe, who will speak about women leadership and equity in NTD research. During the session, please feel free to introduce yourself in the chat and type in any questions or comments you have as well, and we will address them in the discussion portion of the session. Please note that this session is being recorded, so please make sure to keep your microphone muted and your cameras off until the Q&A period. At the end of the webinar, we have a few exciting announcements, so please stay till the very end to hear about our upcoming activities. Our session moderator is Dr. Maria Gonzalez, who is a specialist in education for social transformation. She leads projects in the ANISVAD Foundation that center the voices of African women scientists and policymakers who are at the forefront of the fight against NTDs. I will now pass it over to Dr. Gonzalez to introduce our first speaker.
Taking over parts of southern Lebanon and it continues to fight Hezbollah.
Thank you, Barsa, and good morning, good afternoon, everyone. I guess, depending on where you're joining us from. It is a real pleasure to be here today at this Knowledge Cafe titled Equity Matters, Women Advancing NTD Research and Policy. Although we are now in April, I would like to remind that just a few weeks ago, we marked key global moments such as the International Day of Women and Girls in Science and International Women's Day. These moments serve as important reminders of the relevance of the conversation we are having today. They remind us of something fundamental, that equity is not only a matter of fairness, but a necessary condition for advancing knowledge and improving for the quality of public policy. And when we talk about neglected tropical diseases, this becomes even more urgent. We know that women remain underrepresented in scientific leadership positions and in global health decision-making spaces. But this is not just about numbers. When women are not represented in research design, in setting priorities, or in shaping policy, the consequences are real. And some of them, occupational exposures that disproportionately affect women remain invisible, differentiated social and economic impacts are overlooked, and biases are reproduced, affecting quality of science, access to care, the quality of treatment, and health outcomes. Equity is not an add-on, it is a condition for producing better science and better public policy. And especially in the field of NTDs, where structural inequalities are already deep, integrating a gender perspective transforms not only processes, but also outcomes. I would like to take a moment to remark that at ANISVAD Foundation, this commitment is central to our work. We work to support the right to health for people affected by neglected diseases, especially in sub-Saharan Africa. But we also recognize that there cannot be health justice without gender equity. This also requires ongoing reflection on our own role, the assumptions we bring into our work, and the ways in which global health systems can unintentionally reproduce inequalities we seek to address. In that sense, we try to approach our work as a process of continuous learning and adjustment in dialogue with the people and contexts we work with. In our work, we try to engage with and support initiatives such as those that recognize and amplify the work of African women scientists and decision makers leading responses to NTDs, those that help create spaces for reference and exchange for girls and young women, Also those that encourage more inclusive and more equitable narratives in science and international cooperation, or those that acknowledge scientific careers committed to advancing equity. We make this through podcasts, comics, exhibitions, awards, and dialogues spaces like this one. We try to contribute to ongoing conversations about how narratives are shaped, and how recognition is distributed, and how leadership in global health is understood. Because for us, these spaces are not only about visibility, they are also about listening, learning from different experiences, and reflecting on how knowledge is produced, valued, and shared. And today we have the privilege of hearing from two women that are not only conducting research or managing NTD programs, but who are redefining what it means to lead with an equity perspective. And it is my honor to begin by introducing our first speaker, Dr. Gloria Dadachechet, who is a molecular parasitologist and associate professor of biochemistry at Ahmadu Bello University in Nigeria. Her research spans neglected tropical diseases, diagnostic innovation, and pathogen surveillance, alongside critical analysis of gender and intersectional inequalities in global health research and policy. She is the scientific lead of the EDCTP3-funded Multiplex AI Consortium. And we would also like to add that she participated in the first edition of Fundación ANESBAT's Learn Africa Scholarships program. Dr. Gloria Tzet, the floor is yours, please.
So, thank you so much for this opportunity to present. Hello, everyone. Today, I'll be speaking about why women's leadership matters in NTD research. Please, can you see my slides?
Yes, we
Okay,
can.
thank you. So now this is often framed as a question about, fairness or representation. And yes, it matters, but it goes way much deeper than that, as it is core. And this is about how we do science, whose perspectives, shape the science, and how effective our solutions are in communities that are mostly affected. So in many NTD endemic settings, especially across sub-Saharan Africa, women are not just affected. Women are central to the system, either as patients or as caregivers, or even frontline health workers. And yet, when it comes to leadership and decision-making, their presence remains very limited. So today I'll walk you through that gap, why it matters, and what we can do realistically about it. So before I continue, I would briefly walk us through the structure of the discussion. We'll start with the burden of NTDs, and then we look at the gender gap, in research and leadership. And from there, I'll share some evidence of inequality and then explore why the gap actually matters. And finally, I'll focus on what needs to change and how we can move from evidence to action. So let's begin by grounding on the scale of the problem. NTDs affect over 1 billion people globally, and the burden remains heavily concentrated in low-resource settings, particularly across sub-Saharan Africa. But beyond these numbers, what really matters is who is mostly affected. As I said earlier, women are not just patients, but they are also primary caregivers, often managing illnesses within their households while they are facing their own health challenges. And in many conditions, they account for a disproportionate share of severe health outcomes, which are driven by a combination of either biological exposure or even social roles or limited access to care. And this is where the issue becomes more complex. While women carry out significant part of the burden, they are not equally represented in the spaces where these decisions are taken. And this is where the leadership gap begins to emerge, and a disconnect between lived experience and who is actually shaping research priorities and solutions. So to really understand this gap, sorry, next slide, okay. I have a problem. Good. Yes. So to really understand this gap, we needed to go just beyond numbers, and we looked at this from three key angles. First, a review of the literature to understand the research landscape in order to understand how women are represented in NTD research. And then secondly, we analyzed existing evidence to identify patterns in who leads research, who gets funded, who shapes the work. And thirdly, to the context and lived experience, because the realities within African research systems, including the structural and institutional barriers, strongly influence who progresses up to leadership positions. And this allowed us to move from asking how many women are present to a much more important question, which is what kind of influence do they actually have? And when we look at the data, the gap becomes very, very clear. Despite the significant role that these African women play in healthcare systems, their representation in leadership remains extremely limited. For example, there's only about 3% of African women that are represented in WHO NTD committees. And these are spaces where priorities are set, where funding decisions are made, and where interventions are defined. And yet, the voices of those that are most affected is largely missing. And what this shows is not just underrepresentation, it's a structural disconnect between burden and decision-making power. And this disconnect has real consequences, as it directly affects how research is being designed, whose needs are prioritized, and how effective our interventions are. So the next question is then, okay. So the next question is, why does this gap matter so much? One of the clearest ways in which this gap shows up is how research is being funded. What we see is a kind of glass ceiling in access to these research resources. The male researchers are more likely to receive, higher funding. They lead large international grants, and they also benefit from very strong institutional support. In contrast, the women researchers, particularly African women, often have limited access to large-scale funding and are usually underrepresented as principal investigators. And this only creates a compounding effect. Less funding means fewer opportunities to lead projects. Fewer leadership opportunities means slower career progression. And over time, this leads to fewer women in leadership positions. So this is not just about fairness in funding. It's about how funding structures shape who becomes visible, who advances, and ultimately who leads. Now, when these kinds of structural barriers exist, they don't just affect individuals. They affect the entire research system. So when we talk about this leadership gap, it's important to be very clear. This is not just about representation for its own sake, but it has real consequences for science and health outcomes. So the first thing we see is research bias. When the leadership is not diverse, research agendas can overlook conditions that disproportionately affect women and girls. The second thing here is data gaps. Without sex disaggregated data, it becomes difficult to design targeted, effective health strategies, and we end up working with incomplete pictures. The third point is that it is a clear loss of, there's a clear loss of innovation, because when perspectives are very limited, the ideas are also limited. So diverse leadership actually would bring different ways of thinking. And without that, scientific progress basically slows down. And finally, we see what is often described as the leaky pipe. Talented women enter the field, but do not make it to leadership roles due to structural barriers, limited mentorship, and restricted opportunities. So overall, Excluding women from leadership does not just create inequality, it weakens the entire research system. So the question now is, what do we do about it? How do we actually begin to close this leadership gap? In my opinion, I think there's no single solution, but there are three key areas that change is needed. One is reforming the system. Two is strengthening leadership pathways and investing in women researchers. So starting with the institutional and financial reform. This basically shapes research leadership because at the moment, many of the barriers we've discussed are not just individual, like I said, they are structural. And the first thing is mentorship. And we need structured long-term mentorship programs, especially for women at the mid-career stage, where most of them are lost from this pipeline. Secondly, funding equity, because equity has to be built into how funding decisions are made, not just about who receives grants, but it's also about who sits in the review panels and shapes those decisions. And thirdly, leadership representation. We need to actively promote diversity in research governance, ensuring that women are present in decision-making spaces, not just participating, but also leading. The fourth point is visibility. We need to highlight and amplify the work of women researchers because visibility builds credibility, and credibility basically opens doors to leadership. And finally, targeted support for undeserved settings. Women, especially those working in rural or hard to reach communities, often face the greatest barriers and yet are closest to the communities that are mostly affected. So investing in them is quite essential. So this is not just about a single intervention, like I said, it's about aligning mentorship, funding, and governance to create a system that actually enables women to lead. So beyond just reforming systems, we also need
Gloria, excuse me, we cannot hear you. I don't know if there's a problem with the audio.
Can you hear me now?
Yes, perfect.
Oh, okay. I'm so sorry. So I'm wondering where you lost me. Maybe I could just recap a bit, or I just proceed.
You can proceed. It was just for some seconds, so don't worry.
All right.
Go on.
Okay. All right. Thank you. So like I said, beyond just reforming systems, we also need to focus on the pipeline itself. You know, how do women actually move from entry into research all the way to leadership roles? Because this is where we often lose people along the way. So the first thing is to start with these entry points. We need to be intentional about creating opportunities for women, you know, to enter NTD research early and to also see a future for themselves in these spaces. Then comes mentorship. Not just the one-off training, but you know, a sustained long-term support that helps women to navigate real career challenges and still stay on track toward, you know, the leadership roles. And then also we need stronger frameworks, meaning integrating gender and intersectionality into how research is being designed, how it is funded, how it is evaluated, not just treating it as an afterthought. And finally, the culture matters. You know, even with opportunities and support, if the environment is not inclusive, people will leave. So we need workspaces or places that are flexible, that are supportive and genuinely enabling. So the final piece of this is investment, because without sustained investment, even the best policies and pathways, you know, won't take us very far. So the first thing we need is to improve access to funding. We need women-led projects, you know, which enable or which are able to compete for and secure large research funding, not just small or short-term grants, but Funding alone, like I said, is not enough. We need institutional support. We need infrastructure. We need administrative backing and systems that actually enable women to lead and manage these researches at scale. And then capacity building is also very important. We need to invest in training, in leadership, and development, and research skills across all career stages, so that women are not just participating in the research, but they are also shaping it. And finally, retention and progression. We need to support long-term career growth and ensure that these women don't just drop out and when they are about reaching these leadership levels. So when we bring all of this together, it becomes very clear that closing this leadership gap is not about just one intervention. It requires a sustained and coordinated action. Oh, I'm sorry. Good. Now, we've talked about what needs to change. We've looked at systems, we've looked at pathways and also investments. But the real question is, what happens when we actually get this right? What changes when women are not just participating in research, but are leading it? Because this is where the conversation basically shifts from equity as an idea to impact in real world. And so when women lead, the first thing, so sorry. Now we're back here. Sorry about that. Right. So when women lead, the first thing that improves is research quality. You have diverse leadership bringing about different perspectives, which makes the research even much more relevant and accurate and more impactful. And this translates into even stronger policies, because the decisions that are shaped by people who better understand the realities of the people that are mostly affected are involved. And then we also see a more effective disease control, because the interventions become more targeted, more context specific and more sustainable over time. And most importantly, we see real health impact, because these communities benefit from research that actually reflects their needs, their experiences, and also priorities. So this is not just about fairness, it's about better science, it's about decisions, better decisions and better health outcomes. So if we bring everything together, what needs to change now? The first thing we need to do is to fund women-led research, not just in principle, but in terms of with access to competitive large-scale funding. Secondly, we need to reform leadership structures. Who sits in these decision-making tables matters, and that needs to change. And the third point is we need to build sustained pipelines, not just one-off initiatives, but long-term systems that support women from entry levels, all the way to leadership levels. Because when these changes happen together, the impact actually goes far beyond representation. So at the end of the day, this is what it all comes down to. Equitable leadership improves research quality. We begin to ask better questions. We design better studies. We generate more meaningful results. And then gender responsive policies strengthen health outcomes, because the interventions are now shaped by deeper understanding of communities that they are meant to serve. And investing in women, basically strengthens NTD control overall, and it makes our systems more responsive. It makes it even more effective and more sustainable. So this is not just about fairness, it's about improving the quality of research and the lives of the communities that suffer from these diseases. And so on this note, I would, and on behalf of my colleagues, I would like to thank you so much for your kind attention. Thank you.
Thank you very much, Gloria, for your presentation. Your words are always really interesting. I hope that everyone that is joining us are saving their questions for later in the discussion. But let me now turn to our second speaker, Professor Emiliane Epe. She is a Cameroonian physician, professor, and national public health leader. As head of Cameroon's Neglected Tropical Diseases Control Unit and full professor of ophthalmology at the University of Yaoundé. Founder of Women in Neglected Tropical Diseases, she mentors the next generation of African women scientists and decision makers. Within the WINS initiative, she also conducts research on gender and NTDs in a project collaborated with our foundation and SBAT. Please, Emiliane, if you are ready, you can go on. Emiliane, I don't know if you have your presentation ready or if you need a little bit of time or something, but let us know. So meanwhile, Emiliane can start with her presentation. Maybe we can share some of the questions that some of you has made for Gloria. So there is one question of Manuel Posati who says, well, firstly that he's thanking for your presentation, Gloria, and he's asking if you can tell us about the challenges you have faced as a woman in global health or science.
Yes, thank you so much for your question. Yes, I mean, one of the biggest problems I have faced personally is access to opportunities. You know, it could be especially in relation to funding, you know. I mean, that's the basic thing. And, you know, I had to work a lot harder, you know, to be taken seriously. And, you know, besides the funding or access to opportunities, visibility, you know, within the region is something that is a bit difficult, especially coming from where I am from. And also balancing multiple roles because, okay, you are a teacher, basically I'm not a mother, but I have responsibilities of other people around me. And so it's a bit, you know, difficult sometimes balancing these roles, but also within the community where I find myself or the institution where I find myself, you know, it's sometimes difficult to express yourself. So you kind of do your work silently. You have to move silently because of the patriarchal system that I found myself in. So, you know, these are some of the challenges, but basically it's around access, visibility, and being fully heard, and especially in decision-making spaces.
Thank you so much, Gloria, for your words. I think Professor Epe is now ready for making her presentation. Let's try again. Yes, I think, let's see if we can hear you.
Hello.
Perfect.
Yes, please. I shared the presentation. I sent it to Anna in order to have the line going through. It's preferred that she share this while I'm presenting. Is it okay? But I can also try to see if it can work on this end because
We are searching it, but maybe you can start if you want with your presentation.
Are you seeing it now? Are you seeing the presentation?
Yes, we can see it, but just in a small way. If you put it in full screen, we could see it better.
Okay, let me see what I can do. The programmer, will it work?
Perfect.
Okay. Thank you very much for giving me the floor. I was already introduced, and thank you for the kind words that you used to introduce myself. I'm standing before you today as a surgeon, a professor, but also like a public health person who led some programs. After all these years, I've learned one simple truth that I want to share. Equity is not a side conversation, it is a strategy. And let me take you through the journey that shaped this conviction. Many things have been said by the previous speaker, but in this line, we want to be more concrete, go through what she said with examples. For more than 20 years, I've worked across different levels, from clinical to national programs, research to policy, and I've been involved in trachoma elimination, in strengthening surveillance system, and mentoring young scientists. But beyond all those roles, what has stayed with me is not the title, it is the impact. And the pattern is consistent. When women are meaningfully involved in leadership, systems become responsive, more effective. When women lead, systems perform better. But beyond my story, there is a broader reality we need to confront. What is it? In NTD, women are not absent. In fact, they are everywhere. They are in community distributors, mobilizers, caregivers, and they sustain programs at the ground level. When we move upward to coordination, to strategy, to decision making, their presence becomes less visible. So the issue is not participation, the issue is power. Who sides? Who shapes priorities? Who leads? Let me take you briefly through the journey that shaped the conviction in our case. At some point of my journey, we experienced, my group and my team experienced it very directly. We had spaces where women's voices were encouraged, platforms for scientific exchange, visibility, and leadership. Over time, those narrowed, leadership changed, and opportunity shifted. In fact, we had a platform where we built a strong lead within universities and NTDs, universities and programs talking about NTDs. At that moment, when everything narrowed and shifted, we had to make a decision. Do we wait for the space to be given again, or do we create it ourselves? We choose to build. That moment led to something new. And what was it? The decision led to the creation of WINS, Women in Neglected Tropical Diseases, a platform designed to connect institutions, to support women researchers, and create pathways for young women entering the field. Because leadership does not grow in isolation, it needs structures, visibility, and continuity. WINS is not just a network, it is a space where leadership is nurtured and sustained. We need this type of platform to sustain leadership. But platforms alone are not enough. We need action. What action did we take? Equity must be translated into action. The TAG project is one of the examples of this action. It integrates gender into how we design surveillance, how we engage communities, how we reach vulnerable population, especially women, meaning women going towards women to discuss and to build, to co-create, because equity is not an abstract concept. It is reflected in the voices and in the choices we make when we design programs. It is how we design the program, and action must be sustained through the people we are aiming to serve. They should benefit from it. And for this to be sustainable, we must invest in these people, the populations we are going to. We should build their capacity and have something that they will live on, that will live in the communities to be continued. Mentorship in that sense is not optional. It's not an optional activity. It is a core strategy, and it is one of the core strategy of WINS. Through supervision, networks, and communities of practice, we are building the next generation of leaders. The previous speaker talked about allowing people to grow, to have followers. And because leadership is not about holding a position, it is about creating many others. It is people, because when this works, the impact is visible. If you are alone, you are not visible enough, because at one point or another, you're supposed to leave the space. Programs reach people that were previously missed. When women are on board, they can go all the way to the people who are invisible, who don't count. Data becomes more reliable, and communities engage themselves to more, because there's trust, there's exchange, the connection is there. And more importantly, local ownership becomes real. African women are not just beneficiaries when women are in leadership positions where they take action and then decide. And we women we are producers of global health solutions through our interventions. So the question becomes now, what must we change? We need it, but what must we change? If we are serious about eliminating NTDs, there are three priorities. The first one must be to fund equity as infrastructure, not as a side component. We should take equity as a component, as an indicator in everything we are designing. The second one is that we need structured mentorships, pipelines, not one-time initiative. It should be something continuous. And thirdly, gender must be embedded in program design from the beginning and not just at the end, because equity accelerates elimination. I will close with a simple reflection. Leadership is not just about what we achieve individually, it's about what we make possible for others. We are privileged to contribute to this field, but that comes from responsibility, to doors that we open, to opportunities that we create, to lift others. Because at the end, it is not just us, it is equity, and equity is not symbolic. It must be structural, and it is essential. Equity is not about being seen, it's about taking part of power, deciding for others, and making things grow. Thank you for listening and joining.
Thank you so much, Emilian, for your words, your presentation, and your brilliant thoughts on all this theme. I think that we now have plenty time for sharing different questions that you all may have. So I remind you all that you can share your questions in English, French, Spanish, and after we can just talk them in English, but we will highly appreciate all of your thoughts. Maybe I can start seeing Let me just a moment. Here. So Valerie has sent us a question. She's saying thank you for your presentation, Gloria, and she's asking about what are your thoughts on the impact of society and culture on women's leadership? How do you think these challenges can be managed or addressed?
Okay. I think society and culture plays a very big role, often in very subtle ways. And in many settings, there are still expectations around what women are expected to do, how women should be visible, or how visible women should be, or how far they should go professionally. And it's not always said directly, sometimes it's said in very subtle ways. But this influences confidence, it influences opportunities and how others respond to women who are in leadership positions. And sometimes it also affects how women are perceived. You can be perceived as being competent, but you still have to prove yourself even much more. And sometimes you're taken less seriously at first. But I don't think it's something to be fixed. These are things that will change over time, I believe. And what helps is creating the right environment for strong mentorship, for fair access, especially to funding, and leadership roles, making women much more visible within the spaces that we find ourselves. So when people start to see that women are leading, I think it will gradually become normal. And that's when the culture would begin to shift. And that's what I think.
Thank you very much. I would like to remind that although there are questions in the chat, if anyone wants to join online and make their own questions, you can do it by your own, just joining us. And if not, I will just read them.
Sorry,
but I'd like to make what?
Okay. Sorry, did you hear my response? Because I think I froze.
No, you were perfect, Gloria. We could hear
Okay.
you. I was just inviting the people that have just made question of if anyone has new ones to just do it directly if you prefer, and if not, I can read them, but it will be, I think, more interesting if we can just have a conversation all together. Okay, I think Nana has raised her hand. Please go on.
Okay. Thank you very much for the opportunity to ask this question. And I think that in talking about equity in regards to women and their participation in leadership roles, particularly within the NTDs, I think a lot has been done. I don't know if the speaker would dispute this, but not too long ago, particularly at the global level, I realized that it was basically women who were leading the charge in organizations like the USAID in regards to NTDs, at the Gates Foundation, before the demise of Dr. Mwele Malechela of blessed memory at the WHO. That was a woman. Until the current person who leads the NTDs at the WHO in Brazzaville. It used to be a man, but for the last couple of years, I think you agree that it's been a woman. And so the point I'm trying to make is that women are doing well. When you go to the national level too, you come to find out that many more women are assuming the position of program managers of the national programs. My question to the speaker is that if she does acknowledge that the point I'm making is right, what has been, in her opinion, has been the difference in having these women at the helm of affairs within the NTD communities? That is my point. Because I think they are doing well. A lot of them have done very, very well. And it's not going to stop. It's just going to get better with time. But since we were talking about equity, what would she say? And I know at the community level, with work that was done in the past in regards to community directed approaches that the NTD program actually pivots on, you'd also realize they found out that many more of the community drug distributors were actually women, and they worked much better than the men. They worked much better than the men in terms of their output and their commitment to the work that they did at the community. Is it possible that the speaker could speak to it or provide some evidence or what these women have changed or have done better than, I wouldn't say the men. I don't think it's a competition. I think it's a great contribution they are making. So I wouldn't say did better than the men, but what can we say to support, to advocate for more women in these positions? She has, I'm sure she's touched on a few, but based on the points that I've made, I'm asking, what else does she think women should be doing in order for them to get better recognized in the leadership roles that they occupy? Thank you very much. I hope you got my question.
May I? There's a
Yes, please.
moderator. What's your question? So the moderator should give the...
Okay. Thank you.
Okay, thank you very much for your question. And it's a question that I was expecting and that I have the opportunity to answer almost every day. You cited women in a powerful position. You cited WHO. You cited Brazzaville. I was expecting you to say something about Cameroon because from your voice, you are from Cameroon. I might
No,
make a mistake.
I'm not from
Okay, so
Cameroon,
I was
but I have lots of friends from there.
okay. So let me tell you that in Cameroon, we have 5 programs for NTDs, and all of them are led by men. Okay? We have 10 regions with focal points. At the regions, 2 focal points are women, the rest are men. What are we talking about? But it is true that when you come to women distributors, they are the best. They are the ones who are more organized and who sustain the work better than men. You see what we're talking about. So what did we do? I'm a chief of service of NTDs at the level of the ministry. It's because we sit at those tables, we see the gap. Most of the time, we don't get to have our questions or our suggestions being examined to the level that we are satisfied. When a woman sits somewhere, we have to respect some of the, let's say, usage. So we felt that we don't get the voice that we want. And if you are few, you get, let's say, undermined most of the time or some of the time. Now, what did we do? I want to be, because this exercise or this webinar was to talk about my example. My example was that we managed to have what we call journée scientifique, scientific days to discuss about NTDs. And those days were carried out by women scientists. Because we had somebody who listened to us and who gave us that space, who got that sponsored. As I said before, the voices narrowed. The other people could not give us the same space that we needed to continue, and they stopped. there we were. At that point, we created WINS, Women in Tropical Neglected Diseases, here in Cameroon. And Women in Tropical Neglected Diseases now has a broader space to have all the women interested in leadership position or interested in contributing in NTDs to come, and we have the voice there. And Women in Neglected Tropical Diseases is having space now, is being heard. We are having impact, especially when we have to talk about changing behavior, approaching communities. We usually like to say that we go where the state cannot reach. That's where we start, so that we meet somewhere, and that way we accelerate the fight against NTDs. You also answered the question, talked about the drug distribution. I myself had a study talking about distributing azithromycin for data. We did a study in three. We analyzed the data in 3 countries, and within those 3 countries, you cannot discuss. When women were involved, they had better approach, they had better geographical coverage, because women have this convincing way of talking to people. They can be charming, they can change things, they can bring people to adhere to the intervention. And this is something that should not be left out. It is something we are gifted for that, so we can do that. I hope that I answered your question. If we have to say more, we could continue to say more, but let me leave the floor to other people. We are still there. Thank you.
Okay, thank you so much, Emily, for that response. I mean, I just want to maybe correct a bit about I didn't get the full question because my internet went off. But I just want to correct a bit about the statistics that he gave from the beginning when he mentioned that there are quite a number of women, in NTDs, I think at the WHO or so. I think like you rightly mentioned, there have been few women. I mean, for the past 10, 20 years, up to when Mwele was alive, I think there had been really few women. So the representation of women, especially African women, had been so poor. So, but I mean, like you said, once the women stepped up and the changes began to improve, the representation improved, and then you see the impact. Like you said, women, we have a way of speaking, we have a way of, the communities actually trust women better, because I've worked with certain communities, and when women are involved, the trust is there, and then you have the support, so things move. But I mean, these things have not been like this until, I would say, recently. So that was just something I was going to add. Sorry, I don't know if you can hear me. Maybe my network is off again.
No, Gloria, we can hear you perfectly. And also, Emilian, thank you for both of you for your answers. Really inspiring. I would like to share also. No, there is one person who want to talk, so please go on. Let me see. I think someone raised their hand. So does anyone who wants to make any other question? We have a little bit more time. If not, I can share some of the chat, some from the chat. Alison, I think you raised your hand.
Yes, I had put something in the chat. It was a question for Dr. Epe, and thank you to you both for your excellent presentations and just for highlighting some of these really important issues. I was just wondering, I made a question for Dr. Epe with regards to her involvement in trachoma elimination over the years, and nice to see you here. I was just wondering, because I think Dr. Gloria mentioned, both of you mentioned the use of disaggregated data within programs and how important it is to be able to measure differences between males and females. And so I'm just wondering, from your experience in Cameroon, do you have that? Do you have the disaggregated data available? Like, is that something you're doing in Cameroon? And if so, how does that data help you to drive decision making? Thank you very much.
Yeah. I'm not sure I understood your question well. Are you talking about disaggregated data among the people who are working or the population receiving the treatment? Which one are we talking about? If we are talking about the data among people who are involved in sharing, like let's say distributors, we have disaggregated data. Even the patient receiving the drugs, because I am involved in trachoma at the level of surveys. What happens within a certain time when we distributed the drugs? And those data is aggregated. We know what men are doing, how women are doing, and how children are doing, and they're very important because when we do the calculation to have an impact, we need to know how many children we involved. Although the disease is more on the side of the women are suffering more than men who are usually not around the children. And as you may know, I'm sure you know, it's the transmission between women and
I think we've lost Professor Epe, and we are also running out of time. So, although we know there are, oh, she's back. Emilian, we've lost
yes,
you, but
difficult.
you're just
I hope
one
she
more.
got I hope she got me because the network is getting poor. Thank you.
I think she did because she reacted in the chat. So thank you, she's saying. And I was saying that we are running out of time. And I will just wanted to thank to all of you for taking part on this conversation. And I wanted to invite Barsa to make the closure of this little talk that we've just had.
All right, thank you so much. Thank you so much to Dr. Gonzalez for moderating this session and our speakers, Dr. Gloria Dada-Cheche and Dr. Emilian Epe for presenting at our Knowledge Cafe today. So I just have a few announcements to make. So 2026 is an exciting year for iCourts. In the last few months, we put out the posting for the hiring of an African regional manager, which we are currently still in the process of reviewing the applications. I would also like to announce that iCourts will be establishing university chapters in Africa. So if you are a club, association, group, or network connected to a university in Africa, and you are interested in starting an iCourts chapter at your university, please fill out the registration form using the link in the chat. There's also a QR code on the bottom right side of your screen. Registered individuals will receive more information on how to complete the RFP process. Also, if you would like to attend more knowledge cafes like these, please sign up as a member using the link in the chat. Our next Knowledge Cafe will be hosted on May 13th at 8 a.m. Eastern, and it was developed in collaboration with Glide. So this Knowledge Cafe is titled Sustaining Elimination Through Integration, Pacific Lessons for NTD Programs. You will find the QR code on the upper right side of your screen. So stay tuned on our social media for more details on the speakers. And lastly, thank you all for attending. Please take a moment to fill out the Zoom poll before you leave. Thank you, everyone.
Barsha, there are some people asking if you can share the poll again, that they've lost it. I don't know if it's possible.
So on my end, it says that it's still sharing. Can someone else confirm for me? If you also filled out the poll, it will show you the results after you completed. Okay, thank you so much for your feedback. I will try to troubleshoot this. Okay, it should be working now. So if you have not filled out the poll, please do so now.
Hello. Well, no, it doesn't allow you to finish, and then it goes off
Okay, that's really weird. This has never happened before.
because it takes some time to think through another topic. So I was hoping that,
Okay. Well, what I can do is I can send everyone the poll questions via email. So if everyone would just fill that out instead, I think that would be better. So please keep an eye out on in your emails for in the next hour or so. You should be able to get the poll questions and fill and answer them via email and send them back to me. That would be great. Okay, thank you so much, everyone. So I think I'm gonna leave the meeting room open for another minute and then we could end. Okay, so now it is 10:05, so hopefully if you had a chance to scan the QR codes and fill out the Zoom poll. I will now just end the meeting. Thank you so much again to our speakers and our moderator for presenting and moderating at this session today. I will be in touch with you all via email, so please keep a lookout at your email soon. And I will now end the meeting. Thank you.